We're coming to you live from our studios here at TV Africa. Good afternoon. Welcome to Newsbeat. My name is Kwabena Ameyaw. Now to our first story. Ghana has recorded 264 new COVID-19 cases, taking the national tally to 25,252. That toll remains at 139, with 3,716 active cases. According to the Director of Public Health at the Ghana Health Service, Dr. Bedusa Akodie, the coastal and middle belt remain COVID-19 hotspots.
Total number of cases reported are 5,252 positive cases. These cases were identified through general surveillance and enhanced contact tracing. The total cumulative cases within surveillance, we have 10,105 positive cases. And then enhanced contact tracing, we have 15,147 positive cases. The total number of tests collected as of now are 334,101, with the majority of the samples taken through enhanced contact tracing. On recoveries and discharges, total number of recoveries and discharges are 21,391. Unfortunately, 139 people have died related to COVID. Active cases totally now stands at 3,716. And these cases are being managed in the various treatment sites, isolation centers, and then some of them under home management. 25 of the cases are classified as severe, 8 as critical condition, and then 4 of them on ventilators.
Now let's stay a bit longer with COVID-related stories, because the Ghana Health Service has issued an advisory regarding the use of face shield in effort to halt the spread of COVID-19 in the country. According to the head of disease surveillance, Dr. Franklin Asiedu-Bakwin, a face shield should be used together with a face mask and not as an alternative.
But the idea is that you are trying to prevent the virus from getting into the mucosa of any part of the body that may get the infection. So you try to prevent your nose, your mouth, from the virus from getting into you. So what best can you use? And that's how this idea of a face mask comes in. So the indication is the use of face mask. But then there are instances that maybe you may not be able to use the face mask. And let me be clear. I'm reading from the CDC recommendations. And what he's saying is that it's indicated that the face shield is indicated when persons with hearing impairment, or those who care for or interact with a person who is hearing impaired, they may be unable to wear cloth face covering if they rely on lip reading. As we speak now, the gentleman on our left, early stages of this outbreak, you could see that they were virtually wearing nothing. And there was a lot of complaints that why are we preaching face masks and they are not wearing it? It's because we do lip reading. So in that case, you cannot cover the lips and say that you can communicate to somebody who has a hearing impairment. So that is the only indication whereby you can say that I am now going to use face shield. But for the purpose of addressing the challenge of the infection, the first point of call is the face mask. And I think that we want to employ all Ghanaians that let's use the face mask, because that's the surest way that you can actually prevent yourself from getting infection.
Well, that's it for today's edition of Newsbeat with me, Kwabena Ameyaw. Samokitete will come your way with our primetime news bulletin at 6 p.m. Enjoy the rest of our programs. Have a good afternoon.